MacuHealth is a nutritional supplement leader. Our targeted formulas include MacuHealth for daily eye health, MacuHealth Plus for aging eye support, Vitreous Health for vitreous care, Vision Edge Pro for visual performance in athletes, TG Omega-3 for ocular and systemic wellness, and MacuHealth DM for eye and metabolic support. Call MacuHealth today and mention this podcast for special discounts. Experience the difference with MacuHealth. Nutrition you can see.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. Welcome back to part 2 of my interview with Dr. Darren Candow. In part 2, Dr. Candow discusses the power, how creatine helps brain and bone function. And if you're new here and you like our interviews, press like, subscribe, share, and hit the bell. Also, please leave comments. Be sure to watch our full-length documentary, Open Your Eyes, on Amazon Prime, Apple TV, iTunes, Google Play, and YouTube Movies and Shows. And chia seeds, some people say it's anti-nutrient. Where do you fall on that?
Oh, those are all, to me, beneficial. If you look at the Mediterranean diet, the phytochemicals, so many antioxidants, all those, hemp, flax is a big one, chia seeds. If you could and you had a whole buffet, you go to that first, you stay away from the fast fried things and put that in. And those are all beneficial from an antioxidant fiber perspective. Yeah.
So if you could review for weightlifting,
Yep.
and muscle, what are the benefits of creatine for exercise?
Yeah, it comes very multifactorial. So for those who currently lift weights, you should expect a number of things if you add creatine to that. The first one is you're going to get an increase in lean body mass. And we think about half of that is muscle. So that's super important. The second, and likely the most important and robust amount of evidence, comes from muscle performance. You should expect an increase in strength, endurance, and power. And then finally, you'll also get an increase in functionality. Now, the young adult getting off the toilet, out of bed, out of a chair is easy. But as you get older, those things get a little bit more difficult. So those are the 3 caveats where we think you get from a muscle perspective, let alone the bone and brain health benefits. Yeah.
And there's an improvement in agility. Could you talk about
There is.
that? Why does that happen?
Yeah, so agility, balance, coordination, those have been shown now not only in children, but in older adults on creatine there. We don't know very much on the motor unit recruitment patterns or the neuromuscular system per se with creatine, but we think if the muscle is getting larger, stronger, you're having more neural drive. So that might help maintain an increase in some of those parameters, especially around agility and balance. Is creatine improving tendon and ligament strength and endurance? We don't have any data on that as well. And that's why there's a big theory about creatine and collagen. Could those two be combined to consider some of the benefits for arthritis and things over time? So we still have a long way to go, but regarding the agility and balance, we think it may be from an enhancement in either muscle function and or stability or neural drive.
And creatine has been considered a neurotransmitter.
Mm-hmm.
And why is that?
It's only been recently promoted, obviously, in the rodent model and from a cellular perspective. But the thought is it can stimulate the release of a neurotransmitter called acetylcholine. If you go all the way back to university biology, that's the main neurotransmitter that activates our skeletal muscle. And I think creatine has the potential to release acetylcholine across the neuromuscular junction. It's in its infancy. It's never been shown in humans, but there's a thought there as well. Also, that gets more pressure now on depression and anxiety. So creatine is now thought to be acting sort of as a dopamine antagonist, kind of like caffeine does to adenosine. So maybe creatine can help maintain some of those effects from a neuromodulation perspective.
And adenosine helps people with sleep. And there's been
does.
research to show that people who take creatine actually will sleep an hour longer. Can you talk about that study?
Yeah, so that study we published last year, and it was interesting. We didn't measure the mechanisms, but the females who worked out on the days they trained, they actually got about an hour greater increase in sleep than the females on placebo. So the duration was greater. We did not use sleep lab technology, RAM, non-RAM, things like that, or EEGs. But the thought is maybe it has something to do with adenosine, or does it have something else to do with one of the magical areas of the brain? So it's a preliminary study. It has a lot of potential. You piggyback that off about 5 or 6 really good studies that show that creatine decreases symptoms of sleep deprivation. And so you combine those two, and maybe those that are really impaired by sleep, jet lag, mental stress, fatigue, it's something to at least consider. Yeah. The brain uses creatine just like our muscle for energetics. So maybe if there's more creatine in circulation, the brain will eventually tap into it when need be during times of metabolic stress, and that might help cause that organ to recover quicker and maybe allow it to function better.
And we're going to talk about brain in a little bit, but you
Mhm.
need a bigger dose to get through the blood-brain barrier. Is that correct?
Yeah. Yeah. So the blood-brain barrier is there for a specific reason. And one of the issues with the blood-brain barrier is we have a cell called astrocytes. It's kind of like the main a sort of a glial cell that allows things to move from the endothelial cells into our cells, or part of our muscle tissue as well, and brain. But the doorway or transporter for creatine to get taken in is lacking in those astrocytes. So creatine through circulation getting into the brain is really blunted. And then you combine that with the brain actually makes its own creatine. The theory is that the brain only relies on supplementation or dietary creatine when it's needed. And during times of metabolic stress, it might signal, hey, we need help. And that's why it can accumulate slowly. But we think, unlike muscle, you need a higher dose or longer period of time.
How about creatine's effect? Does it affect testosterone at all?
We're not really seeing any effect. A recent paper just came out the last month, I think it was, on creatine and baldness, the one of the biggest myths, and it didn't have any effect on bound testosterone, free testosterone. So without having an effect on free testosterone, if it's not getting through the plasma membrane and affecting DNA, we're not seeing any effects there from a hormonal perspective. Very rare does creatine affect hormones. It's been shown to increase growth factors, insulin like growth factor 1 or myostatin, but it really doesn't have much effect on testosterone, growth hormone, things like that.
Well, you and me both take creatine. I don't know if that has
I
any.
know, exactly, exactly. I was going bald way before I started anyway, so
So it does increase dihydrotestosterone,
it
right?
does.
HD.
Yeah.
So
Yeah.
that's where the baldness thing probably came.
Yeah. And this is an important distinction. The study that showed it took 20 grams a day. The latest study where they only gave 5 grams had no effect on DHT. So now we're starting to do another study coming up, dosing. Maybe the high dose was too high to cause that, or a lower dose might not have any effect. So that's an interesting comparison.
And talking about dosing, let's talk about that. I know like the standard dose is around
Yep.
5 milligrams,
Yeah.
but tell me about different ways of dosing,
Yeah.
loading dose, if you like, if you're
Yeah.
a big believer in loading dose,
Yeah.
and different ways to do it with athletes
Yeah. So
or
I think if
go
you're
to the gym, a regular
Yeah,
person.
so I think if you're an athlete, training for something that's upcoming, really demanding, and you're looking for a really rapid boost, the most effective way to saturate your skeletal muscle is this loading phase, and that's 20 grams a day for about 5 to 7 days. That has been shown clearly to saturate your muscle. Once you've done that, you can reduce the daily dose all the way down to about 2 to 3 grams a day. Now, the issue with that is it can cause with acute weight gain and water retention, which a lot of people don't like. It can also cause a little bit of GI tract irritation because you're taking in so much creatine. Creatine is osmotic. It likes to take water with it. So as it moves throughout the body, that's why a lot of people might get about a 1 to 3 kilogram increase in water retention with the loading phase. You do not need the loading phase for it to be effective. For those listening to this and say, okay, I'm a little tempted to try creatine supplementation, I think if you're just taking it from a muscle perspective, start as little as 3 grams a day. That'll take about a month to saturate your body. You'll get accustomed to it. You'll know if it's for you. You should not have any adverse effects, no weight gain there as well. That's about a serving in one salmon steak, so it should be very, very fine. You can slightly progress up there after 3 grams for the first month, move it maybe up to 5, which is the traditional daily dose. We think that's a very viable amount for skeletal muscle. The issue comes in, what about all those other systems of the body? So from a bone perspective, the lowest dose that have shown to be any bone benefits, they're minimal benefits, but they are benefits, is about 8 grams in combination with weight training. And then from the neck up, we're still in its infancy. We still don't know the optimal recommendation. The vast majority of the studies look at 20 grams a day for about 7 days. Now, that is the loading phase. Or you can take a lower dose, but you need to take it for months, likely because that blood-brain barrier thing we talked about. So when I've done the math, it averages out to about 10 grams a day from a muscle, bone, and brain health perspective. Is 10 the best? We have no idea. That's personally what I take. And I think a little bit more is fine. We're not seeing any safety or adverse effects there as well. But for those listening, just wanting to try it, I think start as little as 3 grams a day. See how you do. You can take it in the morning with food, whichever you like.
Back in the 90s, the Harris protocol, I remember we used that, started with a loading dose of about 20 milligrams a day, I think for about 7 days, and then dropped down.
Yeah, it was 20 grams, not 20 milligrams, 20 grams a day. And in his paper, actually, after 2 days, you were excreting the majority of the third day onward down the toilet. So the recommendation is maybe you only need the loading phase for 2 or 3 days, and then you can substantially reduce it. So the cool thing with that series of study with Harris and Holtman, they looked at the loading phase, which was fantastic. They also looked at that 3 grams a day, and it took 30 days to saturate skeletal muscle. And then you could reduce it down to 3 grams or even a little bit, sorry, down to 2 grams and maintain that as well. So you don't need a lot. This is not talking about protein where it's hundreds of grams. It's a small amount.
Let's talk about bone health.
Yes.
What are some of the new research that you found on bone health or other researchers? And you mentioned you have them use 8 grams instead of 5 grams for bone health. But still, as people, we're worried about as people get older, becoming sarcopenic or, become catabolic. And so talk a little bit about that.
Yeah, my colleague, Dr. Phil Chilibek, and I, we've published quite a few in that area, and great colleagues in Brazil, Drs. Bruno Gualiano and Hampton Rochelle, have looked at creatine and bone in that part of the world as well. And it's really come to the forefront. So the effects are very, very small, but there's a couple key things here. So the Brazilian group has looked at 1 and 3 grams of creatine a day without exercise for all the way up to 2 years and found absolutely no benefits. So the key here is that exercise is likely the driving force. 1 or 3 grams is not going to do it. Secondly, we've shown in combination with weight training primarily, 1 year all the way up to 2 years seems to have a more favorable effect on bone mineral density and bone preservation. It was primarily in postmenopausal females because that population is really important with the cessation of estrogen. But about 8 to 12 grams a day for all the way up to 2 years did a few things. It maintained bone strength. It actually had a few bone preservation effects there as well. And then if you reduce the dose down to 1 year, we actually saw an increase in tibial and lower bone or lower leg bone area and geometry. So at the end of the day, the effects are small, but they are there. So what we recommend is take creatine if you are susceptible to aging, which we all are, and have any bone-related issues. It might cause a small beneficial effect. The key one is that the females who took creatine for a year reduced bone mineral density loss in the hip. So I think that's a really important factor because if you fall and suffer hip fracture, it usually leads to replacement. We did not see an increase in bone mineral density. So I think this is important. We're not saying that creatine increases bone mineral density. At best, it seems to have these anti-catabolic. It's like a bisphosphonate. It seems to preserve the bone that you have, which might lead to a little bit more safety or preservation effects over time.
But doesn't creatine increase osteoblasts?
Yes.
Which create bone cells, which biphosphonates don't.
Yeah, in vitro work has showed that osteoblast activity is increased, and the best lines of evidence show that it decreases markers of osteoclast activity or bone breakdown. So if it decreases breakdown, and it might increase synthesis when you do that turnover cycle, that might help preserve or potentially have favorable effects on bone geometry or strength over time. The issue with bone is it takes so long to really occur. That means you need to do these longitudinal studies maybe 3 or 5 years before you notice any meaningful or big effects.
And with biphosphonates, the side effects, there's the jaw, there's the
Yeah.
bone fractures. Are those side effects going to happen with creatine?
Yeah, we've looked at it for up to 2 years and an additional year of falls, and we're not seeing any adverse effects there to the bone whatsoever.
Because the biphosphonates really work on osteoclast,
Mhm.
prevent bone breakdown.
Yeah.
The bone doesn't break down, but it could be thinner and thinner,
Yeah.
thinner, and
One,
you could get some fractures.
yeah, one of the big issues with the bisphosphonates is that it might lead to fragility fractures later on because the bone hasn't turned over and gotten stronger. And we just have no data on long-term effects of creatine on bone there as well to see the effects.
And creatine could have an anti-inflammatory effect.
Mhm. Yeah, that's a sort of a new area. It seems to reduce something called reactive oxidative species or enhance the mitochondria as we get older. And there's been a good lines of evidence of the rodent model, primarily in mice and rats. And then we've looked at some evidence in humans that it reduces cytokines after long duration exercise, so marathon or triathlon. It seems to reduce these things called cytokines that are indications of inflammation. And so maybe the athlete can recover quicker to get back on the field or start training more often. So creatine has more anti-catabolic, and it also has anti-inflammatory effects there as well. So that might explain why a lot of individuals who take creatine can recover quicker to allow them to maintain the frequency of training.
And when you're training, sometimes in between sets,
Yeah,
some people are waiting 2, 3, 4 minutes in between sets.
yeah,
Creatine seems to help with the amount of time in between sets because of how it helps the mitochondria. If you could
yeah.
explain that a little bit.
Yeah, exactly. So if you totally wipe out your creatine stores with a really, really long duration, heavy leg press or chest press, it takes about 5 minutes on average for those levels to come back up to baseline. And nowadays, everybody's in a time constraint. They don't have 5 minutes to wait between each set. Creatine substantially increases the ability or rest time between sets. So it augments recovery after muscle contraction and in between. So maybe now you only need to rest maybe 1, 2.5, 3 minutes at most to resynthesize the muscle. So that's where creatine seems to come into aid. It sets 2, 3, and 4 to speed up recovery. It seems to stimulate the mitochondria to release more creatine through the cytosol so it can be bound with phosphate to allow this energy transduction to occur quicker.
If you could explain what catabolic is, it has an
Yes.
anti-catabolic
Yeah.
effects, why that's important when people get older and
Yeah.
want to try to prevent sarcopenia. Explain it if you could.
Yeah. So the easiest way is to think of anabolic or anabolic steroids making things big. And of course, we all want to have an increase in lean mass, muscle, and strength. But as we get older, starting probably in the fourth decade, we go through periods of heightened catabolism or catabolic. That means we're breaking things down. So think of long-term bed rest. You've broken your arm, put a cast on it. When you take the cast off, the muscle and bone was catabolic, so it's getting smaller. That's a bad thing from a human physiology perspective. So creatine does have anti-catabolic effects. We've shown now in young individuals volunteering to put a plaster cast on during rehabilitation. So the good thing here is that if creatine has anti-catabolic effects and you combine that with the anabolic effects, it could be a synergistic property that will allow the body to not only stay the way it is, but heighten or improve it over time.
Now, if you're sprinting, I
Yeah.
assume that it's very helpful. How about a marathon runner?
Yeah. So the evidence for the anti-catabolic effects, the best lines of evidence come from marathon and triathlon. And this small group did 20 grams of creatine for 5 days before the race. But when they finished, and I believe the shortest duration was 40 kilometers, when they finished the race, these cytokines or markers of inflammation were attenuated compared to those on placebo. So what that really says is, yes, inflammation is beneficial acutely, but that reduction might allow the body to come back to homeostasis, allowing that athlete to maybe recover quicker and get back to training more quickly.
We talked about the anti-inflammatory effect a few minutes ago. What do you think about combining with curcumin?
It's a potential there as well. The thought is also with collagen, or what about NSAIDs, even, Advil or Tylenol, especially with aging, because there's been beneficial effects there. Todd Trappy's group has shown that numerous times. Anything that has heightened anti-inflammatory effects could be beneficial. I look at the omega-3s. Could those combination there have a really beneficial effect? And there's so many studies we'd love to do, and hopefully in the future, in the next 20 or 30 years, we'll be focused on the health aspects of it. Yeah.
If you could, you mentioned collagen, the difference
Mhm.
between collagen and creatine, other than they both start with C.
Yeah. Yeah, so the thought there is, there's a big rage in collagen, and I think it's well established now that collagen doesn't even come close to a complete protein source regarding protein synthesis. But a lot of people will take collagen for skin health or pain or anti-inflammation or anything around cartilage. So ACL issues, ligament and tendon. And so the thought there is collagen can cause some beneficial effects in certain aspects. But I was more thinking of creatine and collagen from a bone or connective tissue perspective in those with osteoarthritis or osteoporosis. Hopefully, someone's going to be thinking of doing the study, but it'd be interesting to see, could the addition of collagen and or creatine to each other be more effective than the other? And that would be an interesting supplement or an area to go forward.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
Since there's not enough studies, but just thinking about it from a practical point of view, what do you think about adding collagen into the shake with the creatine?
No detrimental effects there. If anything, you'll get some small, very small beneficial effects. I usually will put a bit of collagen in my Greek yogurt with whey protein and creatine there as well. Although it's a combination of 3 different amino acids over time, it kind of gives you some of the skin or anti-aging effects. That seems to be the greatest prominence, yeah.
This may be out of your area, but if you know anything about like adding carotenoids with creatine plant pigments for the nutrition part of it.
Yeah, I don't know much about that specifically, but obviously from an organ health perspective, that would be an interesting way to go as well there. But yeah, I can't really make a lot of comments on that. We haven't done anything there yet.
So let's talk about cognition. We mentioned
Yes.
it before. So with cognition, you mentioned 20 milligrams, which could support memory, sleep, stress even. Talk
Yeah.
about that. This is a fascinating area
Yeah.
where creatine can help us. And it makes sense. Creatine's in the brain. I mean, we need
Yeah.
it.
Yeah, it's interesting. So it seems that the more metabolically stressed the brain is, that's where creatine supplementation may help come to the rescue. And it comes from 2 specific areas. So sleep deprivation, individuals who have volunteered to be sleep deprived for about 21 to all the way up to 36 hours. When you take a variety of doses of creatine, and they're quite higher, it seemed to offset the effects of sleep deprivation, primarily by improving memory and cognition, excuse me, the next day. The biggest dose was just done in Europe. One dose, 0.35 grams, so a very, very high dose there. All that simply says is that a large dose can get into the brain. I don't know if that dose is very viable on a daily basis. So we don't know the mechanisms. The thought also comes from animal models. It could decrease inflammation, improve mitochondrial efficiency or brain bioenergetics. So that might allow the brain either to recover more, decrease hydrogen ion accumulation, just like in skeletal muscle. So it could cause that organ to function at a higher amount. There's been good evidence coming out of Utah. It's a great psychiatry group there showing that in combination with medication, that creatine added to antidepressive or anti-anxiety medications, cognitive behavior therapy as well, it seemed to have some improvements in self-efficacy. And the only study in children during concussion was in children in Scotland. And those children unfortunately suffered head trauma, taking 0.4 grams per kilogram, so about 20 grams for up to 6 months, really improved symptoms of recovery or concussion recovery, sleep, self-efficacy, sleep improvements, headaches went down. So there's something there that when the brain is traumatized or stressed, creatine seems to have some potential there to improve. The other cool thing is there's only been a few studies to measure brain content after supplementation. You usually need basically an MRI for the brain, and it's been shown that creatine can accumulate into the brain. It takes a little bit longer, so I would say the next 20 or 30 years will be the predominance of research focusing on the neck up.
And the German study that you referred to,
Yeah.
did it help improve memory and cognition?
It did after 21 hours of sleep deprivation, and that has been shown in a few studies now. So it's probably dose dependent, and the longer they'll sleep deprived. But if it does hold water, what about people jet lag, working overnight, ER doctors up for extensive periods, anytime someone's stressed, I always think of university students cramming the night before for a big exam. Maybe creatine could allow the brain to be a bit healthier or function better the next day. And I'll be really interested in the practical applications just because it enhances memory and cognition. Sleep deprivation, does that translate into improvements in activities of daily living or functionality? That's the area we should be going next, yeah.
But this is high doses, 20 grams,
There's
divided
been
divided doses.
Yeah, they're usually dosed over 5 gram intervals, but there's been a few studies. One study showed that 4 grams for up to 6 months in people with long COVID did accumulate in the brain. So I think if someone's taking, 4 to 5 grams a day, it'll eventually saturate your muscle, and then hopefully it will accumulate into the brain. The question comes, what happens if you only take 5 grams a day? You're not active, but your brain is really active. Does that go to the brain before muscle? We don't know that, so we still have a long way to go, yeah.
And did it help people with long COVID?
It did. It really reduced a lot of the symptoms, brain fogginess. Again, Serge Ostiak in Norway has shown this. It also decreased their incidence of headaches in those individuals, so it was an interesting population to look at with symptoms of long COVID, yeah.
And how about theoretically in something like muscular dystrophy?
So that actually population has been shown to have some really good beneficial effects. Mark Tarnopolsky in Ontario has shown in young boys with Duchenne and Becker's muscular dystrophy that creatine improved bone mineral density and measures of muscle performance. So that could be something to consider if you know of a young boy with Becker's or Duchenne muscular dystrophy.
And how about theoretically, to me, it would seem that it would help musculoskeletal problems like
Yeah.
carpal tunnel,
Yeah.
tendonitis, rotator cuff problems, maybe even herniated disc.
Yeah.
Anything on that?
Nothing on any of those, surprisingly. The closest comes to a few studies on osteoarthritis, and it's very mixed. One study showed a benefit, another didn't. Nothing on osteopenia or osteoporosis specifically. And again, so when it comes to the neurological diseases, Parkinson's, Huntington's, multiple sclerosis, not showing great promise yet. Certainly not causing any detrimental effects, but we have a long way to go. I think the issue when it comes to the disease is that you need such a large sample size to cause a significant treatment effect that are very difficult to do. Yeah.
A lot of older people, especially people that are in memory care or
Yep. Yep.
living or long-term care, they really have trouble sleeping.
Yes.
What kind of dosage would you have them try?
Yeah.
Obviously speak to your doctor, but
Yep.
if it was your parent and you had an 85, 90-year-old parent, a lot of these people can't sleep. What dose would you have them try?
Yeah, since we don't really know why it's influencing sleep, I think the easiest would be to take it in the morning, because a lot of times people will drink a little bit more water with creatine, which is usually recommended. It's not essential, but recommended. And that might cause a person to get up more frequently throughout the night because they need to urinate. So that could disrupt sleep. And I often hear that a lot of people, they'll say they took creatine late in the night, they were up all night, almost insomnia. So I think take it early in the morning, see how you do, and then does it cause any benefits to sleep? If you notice it's not really affecting it adversely, then start to take it a little bit later on in the evening, maybe with supper time. So it's more almost like a case study, trial and error there. I like to take it in the evening, especially on the days I'm really mentally tired. I will usually put it in a little bit of Greek yogurt a little bit later on, or some snack late at night if I'm watching TV before bed. I haven't noticed any detrimental effects. If anything, I feel more cognitively awake the next day.
And how many how many grams would you
Yeah.
recommend? I keep saying,
Yeah, so usually in the evening it's about 5 grams. Yeah, I'll either have the gummies or a package of
and in the
grape.
morning for the elderly, 5 grams also if it was a parent.
Yeah, I think older adults do need more than a younger individual based on a meta-analysis we published. But I think if they're just thinking of starting it, start with 3 grams, see how you do, and then work your way up that way. Yeah.
And how about kids like my son who's 15 or these very competitive athletes,
Yes.
whether it's baseball, lacrosse,
Yep.
football? What age can they start taking it, and how
Yeah.
much would you start, and how much would you go up to in grams for
Right.
kids?
Yeah. The best lines of evidence come from review articles of my good colleagues Chad Gersick and Adrian Yagam in the United States, and they've shown that with the current body of evidence, there is no age maximum or minimum. Since they're producing it as well, and they recommend either 0.1 grams per kilogram because they're a lot smaller, or I would use 3 grams. You can spread that out as well, maybe 1.5 with breakfast, 1.5 later. There's currently no detrimental effects with creatine. So I know we put out a big paper last year. I know some states were trying to ban creatine, but when you look at the evidence-based research, we're currently not seeing any reason why a child can't consume creatine, likely because they're already producing it. Based on the totality of evidence, it seems to have a lot of beneficial effects based on the current body of research.
Kids that take lutein, zeaxanthin, mesozeaxanthin, there's a product called MacuHealth that has all
Yeah.
of them in that, and we've seen their baseball improve, less
Yes.
striking out. It helps visual processing.
Hmm.
I'd love to see a study done with like baseball players before and after creatine to see
Yeah.
if that may help their hitting or the power of their hitting, if they would be able to hit harder and hit the ball faster.
Yeah. It is something that is interesting from all, not only, professional athletes, but to amateur athletes as well growing up. And could this compound in combination with their whole battery of treatments, Rory McIlroy has clearly come out and said he takes 20 grams of creatine. Did that allow him to finally make that putt at the Masters when he was so stressed? We'll have no idea.
Right.
I'm sure if it did have any role, it played a very, very minor role. But at the end of the day, it seems to be a more important thing. Caitlin Clark came out. She's added creatine now to her off-season program. So it's something that has been around since 1832. Linford Christie won the gold medal in 92, and he was asked what he was taking. And one of the things was creatine. He might have been taking other things we don't know. And it's really exploded to not just exercise, but more a lot of these health benefits. And that's why I think it's exploded from a worldwide perspective. The thought is 35 million people take creatine currently. The goal would be about 350 million based on evidence-based research in 10 years. So it'll be very interesting to see if I come back in 10 years and talk about it where we're at. It'll be interesting. Yeah.
It's funny, Rory and my son have the same barber
Okay. There you go. Yeah.
area of Florida.
Yeah.
How about fertility? Has there been anything on fertility, males or females?
Yeah, this is out of my wheelhouse, but again, Serge Ostiak has shown that it improved, and we put this out in part 2 of our myths and misconception paper. The thought is where the flagellum will use creatine almost like energy for the motor, could the sperm get benefits, not impairments? The thought was originally that creatine might down-regulate sperm motility and regulation, and Serge has shown now many times that it actually improves vitality of the sperm. So that might have an application for male fertility issues. Again, obviously, anybody with these issues, male or females, please talk to their medical practitioner. But the current body of evidence is not saying any impairments yet.
Anything with cancer, any anti-cancer, decreased risk of cancer?
Yeah. Yeah, this is probably one of the biggest areas next to the brain. So in part 2 of this paper, again, Mark Tarnopolsky from McMaster's, an MD, PhD, one of the world's biggest and best creatine researchers, he was touted with this section. And when he looked at the totality of evidence, creatine seemed to have some anti-cancer properties at recommended dosages. There's been a few studies in rodents at super physiological dosages that cause some escalation of properties of cancer, but we're not seeing anything in humans. And if anything, from those who have had cancer, you'll notice you're usually catabolic. You're losing substantial strength, bone mass, and muscle. So from a rehabilitation perspective, creatine in combination with exercise could be beneficial. And I'm happy to say that Kieran Fairman in University of South Carolina, collaborating with him, we're looking at a few studies in breast cancer as well as prostate cancer survivors. So we're now seeing anti-cancer properties from creatine, likely because of the anti-catabolic or anti-inflammatory properties.
And let's turn our attention to vascular health.
Yes.
Tell us what's new in vascular health. Homocysteine.
Yeah.
Does it affect methylation,
Yep.
endothelial dysfunction, triglycerides,
Yeah.
the cholesterol, etc.?
Yeah, there's been a handful of studies looking at the cardiovascular system in general, but it was interesting. 2 studies this year by Mike Ormsby and Eric Rawson was a co-author on another one. They looked at endothelial function in older adults, and creatine did seem to improve dilation or blood flow mediation in a few of those studies there. Not a lot or big effect, but it was a potential. We actually showed in a group of stroke survivors that creatine improved gait speed. We did not look at any mechanisms, but the people who had stroke, unfortunately, did have impairments in gait or walking velocity, and creatine helped there as well. And then when it gets to homocysteine, you would think if you go back to the way creatine is made, through arginine, glycine, and methionine. By taking the methyl group from methionine, that would eventually decrease homocysteine accumulation. Homocysteine is a big precursor for cardiovascular disease and susceptibility of stroke. And ironically, the research is mixed. Half the studies show that homocysteine is unaffected. Others show that homocysteine decreases. And there's been a few showing that homocysteine increase. So the evidence is very mixed, and we can't really conclude there as well.
Interesting. And
Yeah.
endothelial dysfunction, that's, we can see that in the eye.
Yeah.
How
Yes.
about endothelial dysfunction? Any studies on that?
The only study, not endothelial function, but gyrate atrophy was the longest term study ever done. And they looked at it for up to 5 years at a high dose there and improved type 2 fiber in those people with gyrate atrophy. So that had some application there. But I don't believe in that study they looked at any endothelial blood flow or flow mediation. No.
And how about decreasing body fat? I've seen about 1%.
Yeah, one of the biggest myths is that creatine increases fat mass, and we actually see the opposite. So for adults 18 and above, in combination with weight training, you see a very, very small decrease in body fat, about 0.5 kilograms, or about a 1% reduction in body fat percentage. So at the end of the day, for those consuming creatine, it's not going to increase body fat, it'll decrease it. If lean body mass goes up, maybe the number on the scale is not really affected. So I think those are really cautious areas because a lot of people are very hesitant to take creatine because they think the weight gain is body fat. We actually see the opposite, decrease.
Has anyone ever tried using creatine IV or sub-Q injections?
One study has looked at intravenous creatine just to see the effect in transport throughout the body, but no other research study has looked at that from a practical standpoint. Yeah.
And you mentioned Creapure as
Yes.
a brand from Germany.
Yep.
What other brands do you like besides Creapure? I know you could buy Creapure,
Yep.
Online.
Yeah.
I'm not sure if they sell it at any stores but you can buy it online. Are there any other brands that you like?
Yeah, so I think the basis is just focus on creatine monohydrate. So Creapure is just a form of creatine monohydrate, but it is really scrutinized, safe, and it's found in a lot of products. I know there's a big hesitancy on any of the products coming from Asia just based on the lack of third-party testing. So I can't comment on the purity, but I do know for sure that GRAS status has been linked to creatine monohydrate with Creapure. So I think if the individual is especially for their children or someone like that, look for a product that has Creapure, also that is third-party tested, and therefore you can be very confident that the product is very pure and safe.
And how about other supplements that increase ATP besides creatine? Are you a fan of D-ribose, coenzyme Q10? I know you mentioned magnesium.
Yeah.
What else do you like? NAD, carnitine?
Of those, I think the big one, I definitely have my eye on NAD. So I know the vast majority has been in the animal model, and a paper just came out 2 weeks ago showing that just because NAD is reduced in older adults, it didn't compromise muscle function. But when you look at NAD through the derivative of niacin, if it is reduced with aging, you would really look at the electron transport chain and even glycolysis. So that's the one I'm having my eye on. I'd love to see a lot more randomized control trials in humans. Magnesium is getting a big push, not only for sleep and recovery, but of course linked to ATP when it's being produced as a cofactor. So magnesium and NAD are the ones I'm keeping my eye on for sure.
For magnesium, what kind of magnesium? I usually tell people to stay away from oxide.
Yeah.
But what kind of magnesium do you recommend?
My understanding is the glycinate is the one that seems to have from a recovery and a sleep aid, but I know others take, I think it's called magnesium threonate or something very similar to pronouncing that. But if you're not getting it from food sources and relying on supplementation, I do know Pillar Performance in Australia has a combination of a magnesium product that has all three. So it's something that we'll look at which one is better for which. I know there's about 6 different variations, I believe. Yeah.
And I was excited to see that there's some research in eye for glaucoma.
Yes. Yeah.
That it might protect the retinal ganglion cells and maybe at some point helpful in glaucoma. I know more studies have to be done.
Yeah.
And comment on that.
Yeah, and I love this because when they're like, oh, let's do a supplement, I was like, wait a minute, magnesium is found in legumes and nuts and spinach, and those are the big staples of the Mediterranean diet. And if you look at dietary food first, which we should be focusing on, a lot of these things we've talked about are naturally found in food, and you get great bioavailability and phytochemicals and things like that. But it's interesting. We'll go to a supplement, but when you're like, wow, I'm getting a lot of that through your diet, or maybe I'm not, and that's why supplements are so convenient. But it is interesting when you look at a food first approach. Yeah.
Is there anything that I didn't mention that you'd like to talk about with creatine or anything else?
Yeah, I think, the interesting thing is creatine was just thought of for young males. That's where the majority of research is there. But from a female health perspective, the totality of accumulating research is quite phenomenal. I can't really speak too much to pregnancy, but Stacey Ellery in Australia has shown now that for the mother and during fetal development, creatine is improving brain or bioenergetics there. But females should expect an increase in lean body mass, muscle performance. We've talked about bone density there as well. So I know there's a huge push for female health, and creatine might be one of the components in your whole program to consider.
And is she recommending it for pregnancy?
She's recommending it based on the totality of available evidence. We're not seeing any big safety effects. She started a clinical trial in females now, which is great to see. So based on the body of evidence, we're not seeing any detrimental effects yet. But obviously, for anybody listening that is thinking of becoming pregnant, please talk to your medical practitioner to make sure creatine is right for you.
Yes, absolutely. You got to talk to your doctor,
Yes.
with some great information for
Yes.
people to think about.
Yep, exactly.
Talk to your doctor.
All right.
Dr. Candow, I want to thank you for joining me today. You're amazing, such a wealth of knowledge. It's great to be able to talk to somebody into the same things that I'm into the
Right.
exercise. I can see what kind of great shape you're in, and I really appreciate you joining me.
Thank you so much for having me. I had a pleasure. Thank you.
And if people want to find out more about you, how could they do it and your work?
I think Instagram is the easiest. At Dr. Darren Candow is probably the best way to disseminate all the things coming out. So at Dr. Darren Candow on Instagram. Yeah, thank you.
Well, thank you. I really appreciate it.
Awesome.
Thank you for joining me.
Yeah, thank you so much.
MacuHealth is a nutritional supplement leader. Our targeted formulas include MacuHealth for daily eye health, MacuHealth Plus for aging eye support, Vitreous Health for vitreous care, Vision Edge Pro for visual performance in athletes, TG Omega-3 for ocular and systemic wellness, and MacuHealth DM for eye and metabolic support. Call MacuHealth today and mention this podcast for special discounts. Experience the difference with MacuHealth. Nutrition you can see.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not
Right,
multifocal.
exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode.